Hey everybody, welcome back to my channel. My name is Tori Brame. If you would take a minute, like and subscribe, it would super help me out. I'm really excited. I'm about to cross the 3,000 subscriber threshold, so thank you everybody who is subscribed, and if you're not subscribed but you're watching this, subscribe to me. That would help. Today I am going to talk about emotional blunting and depression. So for those of you who don't know, and just to be clear, I didn't always know, I actually recently found out that there was a name for it, but emotional blunting is what it's called when you do not feel both positive and negative emotions. So I actually recently saw a really good example of this. I have a 4-year-old, and if you have seen Inside Out, the Pixar movie, there's a part where Riley, the main character, she has two emotions that get lost, and it's joy and sadness. So all she has to go on is her leftover emotions of anger, disgust, and fear, I think, is the last one. But joy and sadness get completely lost. That is a great example of emotional blunting, where you don't feel excited about anything, but you also don't really feel anxious about anything, you just feel nothing. So if you've seen those memes where, you know, they usually say something like, I just posted my COVID vaccine photo to an anti-vaxxer moms group just to feel something, you know, like stuff like that. I'll see if I can find some and put them up for you. That's kind of also talking about emotional blunting, where it's like you don't feel anything, so you try to do dangerous things or maybe, you know, super exciting things just to feel something. The reason I'm bringing this up is because I get a ton of questions about emotional blunting with the different medications that I've taken. So I just kind of want to go through each one and let you know what it was like. Before I get into that, I want to talk about some other things that I've heard just in the comments and through talking to people. Oftentimes when people have come off of a prolonged period of depression and anxiety, they want emotional blunting. They want something that will just make them stop feeling. So, you know, people, if you live in a constant state of fear and anxiety, you want that rest. And so sometimes you want a medication that will give you that just rest of emotions where you're not feeling anything. And then oftentimes people can kind of recover on that and then get to a place where they want to feel something again. They want to get off that medication and actually get their positive emotions back, and they're not as afraid of the fear and anxiety. Also, emotional blunting is a natural response. It's not only a side effect of medication. So, you know, in that movie Inside Out, the daughter wasn't on any medication. She just experienced a really extreme life event that led to her depression, and that's why she experienced both sadness and joy getting lost. It can be something that happens just through depression. It can also be PTSD. It can also be other mental illnesses that might pop up that could cause emotional blunting, but it is a very natural thing that the body does sometimes. So I don't want you to think, you know, medication is the only thing that causes it, because it's really not. It is a side effect of some antidepressants. It is also built into the body's natural defense system, where if something really traumatic happens to you, it kind of gives your emotions a rest. It doesn't let you feel anything, just to, you know, be in a state of almost emotional hibernation until you get some time in between that event and you, and then you can actually start processing it again. So the first medication I was on was Buspar, and I felt great. I really felt like it took away the negativity. When I actually first got on it, the nurse described it as turning down the noise. She was also on it, and she said it's really nice just to turn down the noise of extreme emotions in the background. And I really felt that as well for the first couple of months that I was on it. I felt like it didn't really take away my happiness. It kind of took away excitement, like that thrill that you get when you're not on any medication or you're on the right medication, but I didn't really feel like it took away joy. I still definitely felt joy. The longer I was on it, month 3 and 4 and 5, I experienced extreme emotional blunting, like to the point where I felt like I couldn't really talk anymore. I remember my boyfriend being on the phone with me and him being like, I really think you need to get off this medication. Like, it's hard for me to talk to you because I don't feel like I'm feeling anything, like I'm getting anything back. And, you know, of course, like I wasn't open to that idea until I actually got to the place where I didn't feel myself. And it's hard too. I mean, if you've been depressed for so long, chances are you've experienced that emotional blunting. And so just having the removal of the fear, anxiety, depression, all that, and then not feeling joy isn't a huge problem because you haven't liked the other stuff in so long that, you know, joy, like you weren't feeling joy anyway, so why the heck not? After that was hydroxyzine, and if you guys have seen my video on hydroxyzine, you know that I am not a huge fan of it because there was such extreme emotional blunting with me personally. Some people, it's like exactly what they need and they don't experience that. So that just as a caveat for all of these are my personal experiences. If you have different ones, please let people know in the comments because, you know, I am one sample size and I'm just telling my story, so I want to make sure everybody else gets a chance to too. And if you are on this medication, it works for you, definitely let us know because a lot of people read the comments and I want to make sure we have as much information as possible. So anyway, hydroxyzine, I felt like if I took a half a 10 milligram pill, I still couldn't feel anything 3 days later. Like it was absolutely miserable when it came to that. And you know, joy, fear, depression, like it was complete apathy. Like I did not care about anything. After that was Zoloft. Zoloft was such a blur, like a literal blur. I was on it for 4 weeks and I would have been on it for less time, but I wasn't even capable of advocating for myself. Like I was barely capable of keeping my 4-week appointment to see how it was going. So I was catching mistakes that I made at work while I was on it. I was still catching the mistakes like 6 months later, just seeing work that I had done poorly and I had to go back and fix and stuff like that. So Zoloft and me, not a good fit. Definitely a lot of emotional blunting. Lexapro, I didn't really get a good sample size. Like I don't even think I was on that for a full week. And it was because my panic attacks were so bad. So I have talked to people who were on Lexapro and they did say that they experienced a good amount of emotional blunting. There was this one person who I used to listen to on a podcast and she said Lexapro was like a life changer for her. Like no emotional blunting, like it was absolutely lock in key, perfect thing, key and lock. Perfect thing. But I have heard more often than not people experiencing emotional blunting from Lexapro. Wellbutrin, which is what I'm on now, no emotional blunting for me personally. Like it is more of a stimulant. It doesn't work on serotonin. It works on dopamine. So there's a lot of things that are different than the other medications that I mentioned that could be one reason why it's not like that. Another thing is that I feel more sensitive to emotions on it. Like I feel more excited about things. Sometimes when I get anxious, I get more anxious about things. That is another thing, like especially when you get on the higher doses, like 300 or 450 of Wellbutrin, anxiety does get higher. So if you are somebody that anxiety is the thing that you absolutely hate the most, Wellbutrin might not be the best fit for you. Or maybe it would be like Wellbutrin plus something else. For me, I don't hate the feeling of anxiety. Like sometimes I get super, super anxious and you know, that's not anybody's favorite. I would rather have anxiety and excitement than neither. My main complaint was not the anxiety, it was the depression. I did experience a lot of emotional blunting with depression where I just felt dead inside, like I couldn't feel anything at all. For me, Wellbutrin works because I don't mind the anxiety. I have coping skills for anxiety. I do not have coping skills for not feeling joy. That's been my experience with emotional blunting. Again, if I mentioned a medication that you have had a different experience than me or even the same, please let me know in the comments because I think it's really important for people to know that. And I definitely want to hear your perspective. I want to hear your story. And then if you have experienced a medication that I did not mention, please comment that as well, just so people kind of have a a database in the comments where they can look back at this kind of thing. That's really all I have for you guys. Thank you guys so much for hanging out and watching my channel and watching this video. I hope you guys have a great day, and I'll talk to you guys later.